welcome to the Safety Train. My name is Fayo, your Safety Amazon, and today we will be starting off by sending our hearts' feelings to some of the medical workers who have been tackling the national health emergency declared on the Ebola virus disease. We commiserate with the families of those who have lost their lives in this gallant battle, and we pray that the spread of this scourge will be arrested so that all of us can be safe and get back to business as usual. But just before we can surmount this challenge, there are some things we need to know, and that is why I have invited a general medical practitioner, an author, and MD of Adam Health Services Limited, Dr. Tanko, to be my guest on today's Safety Train. Hello, Dari.
Hello, good morning.
Great. It's nice to have you here, and it's always a pleasure to talk about something that would enlighten the public. For instance, we have had it drummed into our ears over the past few weeks that this Ebola virus disease issue has broken out. You know, we've had it drummed into our ears that we should exhibit good personal hygiene practices. So we want to ask you today, what exactly is personal hygiene and why is it important in preventing the spread of disease?
Well, thank you so much for that question. Personal hygiene has to do basically with how you groom yourself and cleanliness, personal cleanliness. There's so much to it. But for it to be put into correct perspective, we need to know exactly how Ebola virus disease started.
Okay,
it all started,
origin.
Yes, the origin. Because if we can understand the origin, then we can appreciate better why we need to take care of our personal hygiene. It all started in December 2013 in Kedu in Guinea with a 2-year-old child that was infected. It was not properly diagnosed, and so the child and the nurse that took care of that child both died. And then later on, from person to person contact, we now have nearly 1,000, in fact 1,000 deaths from person to person contact. Something that started with just one child far away in Guinea. And then it spread to neighboring towns of Macenta and Kisidugo, which were border towns to Liberia and Sierra Leone.
Other countries.
Yes. And so from there, we now have this, and of course we are all aware of how it got into Nigeria.
Yes,
person to person contact. So understanding personal hygiene, how you keep yourself from day to day, you groom yourself from your hair to your nails to the clothing you wear, as well as your feet.
Habits. What about sneezing
habits.
out, blowing your nose?
Sneezing. If we develop good habits about sneezing, some of us, you know, it's easier for me to catch a cold through somebody with a handshake than for me to catch Ebola. Because you sneeze, you rub your hand on your trousers or your skirt, you don't think twice about it, and then you shake my hand, I rub it on my nose somewhere along the line unconsciously, and I start sneezing. So we must understand personal hygiene for us to appreciate that it helps in preventing spread of diseases. Yes.
That is great, Dr. Tanko, because you really just set the premise for us to really delve into this subject. Now, can we start right from our head right up to our toes? What do you have to say about hair care, you know, about the ear, about the nose, about the mouth? Because we've had issues related to personal hygiene, you know, bordering on mouth odor and that kind of thing. And you know, this is what the management consultants put in what they say the Johari window, because hardly anybody, that is something you don't know about yourself, but other people know about you. Because once people step, you know, near you and you emit this offensive odor, the next thing is for the person to find a way to take a step back.
Did you call it again?
Johari window. Oh. Yes, it's a concept in management about something you don't know about yourself, but every other person around you knows.
Very much like the Hercules Hills.
I don't know about that one. We got to go back for an NDA, to Michelle and I. So now we would like you to explain right from our head, our hair, to the ears, to the nose, how do we practice these good grooming habits?
Well, many infectious diseases can be prevented with good hygiene. And starting from the head, you know, you have your hair, which you, if you're a man, you should wash your hair, of course, every day.
Or twice a day, maybe.
Well, depending on the kind of work that you do.
Oh,
if you work in a very dusty environment, definitely, you know, when you get back home, you need to take a bath. Or else you are trapped in traffic or had a very rough day. It's relaxing, it's cleansing, and it prevents transmission to your children and to your loved ones at home.
Great.
So it's very important right from there. Of course, you talk about how you take care of your teeth, brushing very well. You know, you brush up and down and then sideways. You can use you have to get a very good
a toothpaste that has calcium and that has fluoride.
Fluoride, yes.
So we need to read the label on the
and
on
some
the toothpaste.
do have breast cleansers.
Okay, as well.
Yes, as well. Yes.
But some people now take the you know, this mouthwash. What would be the role of a mouthwash?
Well,
would that
the
work
mouthwash-
even if you don't brush your teeth well?
It won't. Of course, it works together with brushing your teeth. But of course, maybe during the day, maybe you are in the office, you could just take, you know, a swallow of it. Particularly if you have problem of bad
Not
breath.
swallow though, you
not
rinse out.
Yes, you rinse out.
Yeah, because it
You-
says
you
not
do-
to be taken.
Yes, you do rinse out because you know you don't use your brush on the inside of your cheeks.
Exactly.
So and it does carry germs, and at times the roof, you should brush the roof of your mouth
And
as
even
well as
the tongue.
Yes, the
tongue
tongue
seems
yes.
to be very
so
important.
if you
as
you
well.
use a very good mouthwash, it takes extra care. Let me use extra care of all these other areas of
Alright.
the mouth.
Now we've heard a lot about hand washing, and this seems to be a key practice that we need to encourage amongst all Nigerians at this point in time. Can you please take us through the proper way and the proper equipment we should use to wash our hands?
Well, okay. Well, talking about hand washing, there is a saying that your health is in your hands because quite a number of transmissible or contagious or infectious diseases.
No, they use
diseases that infect people.
The one we fit pass from Mama Bomboy to Papa Bomboy.
Yes.
They don't transmit to that.
Don't transmit with that, you know.
I don't, doctor.
So your health is in your hands because your hands are the main, practically the means of transmitting or passing infection from one person to the other most of the time. And so you need to wash your hands before you eat, before you feed a baby. You need to wash your hands if you use contact lens before you apply your contact lens. You need to wash your hands after using the toilet, you know, and then definitely if you are caring for somebody that is sick or somebody that is vomiting or having diarrhea, you need to wash your hands frequently. And after handling pets, some of us have dogs, we have cats, you know, we should wash our hands after handling them. Maybe you come back from home, the dog you know, jumps on you, gives you a lick and give it a
gives
pat.
you a kiss, you know.
Yes, you know, you pet the dog, you carry it, you must wash your hands because
And you were telling me something about, you know, visiting like an airport and touching some of the surfaces. So would you recommend that even during office hours from time to time we should cultivate the habit of going off into the restroom and washing our hands? Is that necessary?
No, what I would suggest is simple, that if you make proper hygiene, you should wash your hands anytime you notice your hands are not clean or after sneezing. I was jokingly telling somebody before we came on air that it's easier for me to catch an upper respiratory tract infection, that means a cold or a catarrh, from shaking his hands than to catch Ebola. Because most of us, we shake our hands, we rub it, we don't even think twice about it, we shake other people, and like I said, it goes on and on. But if we have imbibed the culture of, you know, washing our hands, after you sneeze, you wash your hands
immediately.
You wash
Nobody
your hands
needs
immediately.
to tell us.
Yes, and then going into the technique of washing your hands.
Yes,
just putting
that's
hand
important.
under water and removing it after 2 seconds. You know, you have not washed your hands. To wash your hands, you need soap and water.
Okay.
You understand? You put the soap on your palm. You rub the palms together
To form a lather, right?
Yes, until it foams. Then you use your palm of one hand to wash the back of the other hand, and then you repeat with the back of the other hand. Then you wash in between your fingers.
Wow.
With one hand, you know, front and back in between your fingers, and then you interlock. You hook. You hook the 2 hands together.
Wetin go happen with that? Now,
you hook.
black man power.
No be salute. This one now, how to wash your hands, so that you can now twist, you know, up and down to wash the back of your hands. You twist up and down after you
motions.
hook.
After you hook, you now twist.
You now twist up and down to wash the back of the hands.
And what about the thumb?
You wash the thumb separately.
You go rub that one.
Oh yes, you rub it. You rub each one, and then you now use the tips of your fingers to scrub your palm. To scrub your palm.
Dokita, wahala dey. Be like say I go get degree for hand washing. SC hand washing. Now wow.
No, but that's the proper way to do it. Okay. So you do that for both hands, and then you rinse. All this should take at least 20 seconds for you to know that you have properly cleaned your hands.
So that quick hand wash wey you dey circular dey do after you don change the nappy of the baby, no do.
You are still carrying germs possibly in your hands.
Àwọn èèyàn wa ọ̀rọ̀ bí a ṣe máa fọwọ́ wa tó máa mọ́ tí a ò ní gbé àrùn láti èèyàn kan kó ẹlòmíì, òun lè à ń sọ lọ́wọ́. Dókítà wa, ẹ bá wa ṣàlàyé ọ̀rọ̀ bí a ṣe máa fọwọ́ wa tó máa mọ́, ẹ jẹ́ ká gbọ́.
Nǹkan tá a ṣàlàyé ẹ̀ lẹ́ẹ̀kan ni pé ká kàn kí ọwọ́ bọ inú omi, ká yọ jáde, ká gbọ̀n, àti
àìbẹ̀rẹ̀
ìdọ̀tí rárá ní ọwọ́ wa. Àti fọwọ́ bẹ̀rẹ̀ ní omi kì í ṣe omi inú abọ́ kékeré. Ó bẹ́tà ká ní kọ́ máa dà á, tàbí omi tó yọ látinú tap, látinú ẹ̀rọ. So tá bá kọ́kọ́ bu ọṣẹ sọ́wọ́, àwa gbo àtẹ́lẹwọ́ méjèèjì títí tí ọṣẹ yẹn máa fi hó dáadáa. Tó bá ti hó, àtún wá fọ ẹ̀yìn, a fi àtẹ́lẹwọ́ ọ̀tún a fi fọ ẹ̀yìn ọwọ́ òsì. Àwa fi ti òsì a fi fọ ẹ̀yìn ti ọwọ́ ọ̀tún. Lẹ́yìn yẹn àwa fi ìka sí láàrin àwọn ìsàlẹ̀ ìka wa. The base of the
àárín ìka náà ni
àárín ìka
ṣó ti yé yín ma people go
àárín ìka àfi ti ọwọ́ ọ̀tún, ìka ọwọ́ ọ̀tún fọ àárín ìka òsì, àtúnṣe yẹn náà fún àárín ìka òsì ọ̀tún. Lẹ́yìn yẹn àwa mú ọwọ́ wa méjì, àwọn ọwọ́ méjì yẹn àwa so wọ́n pọ̀, a tún máa bẹ̀rẹ̀ sí fọ̀, a máa yí ṣe gan ni, a máa yí. Ìyẹn ni pé ẹ̀yìn ibi tí èékánná wà, a lè dábàá yí bẹ́yìn, a gbó dáadáa. Lẹ́yìn yẹn àtàǹpàkò
àtúnkẹ̀yẹ náà,
a tún yí, a máa fọ̀, tá bá ti fọ̀, a wá mú orí èékánná,
àtúnfi gbó àtẹ́náwó wa.
Lẹ́yìn yẹn la wá mọ̀, a fi gbó tọ̀tún, a fi gbó tòsì, a wá ṣan ọwọ́ ní èdè omi ẹ̀rọ, àbí kéèyàn bu omi. Téèyàn bá tàbádẹ́ rí kárí agbádá tó fẹ̀, abọ́ tó fẹ̀ dáadáa tó mi kúnnú ẹ̀, a lè ṣan ọwọ́ nínú ẹ̀. Ṣùgbọ́n gbogbo yẹn ó láti tóbi ìṣẹ́jú
ìṣẹ́jú àyà.
ogún ìṣẹ́jú nǹkan tó
Ìṣẹ́jú
bá
àyà
ní 20 seconds.
ìṣẹ́jú àyà nǹkan tó bá ti kéré jù yẹn lọ
àìtí fọwọ́ àìbẹ̀rẹ̀. Our people, shey una don hear, dókítà don talk am. He say if you wan wash hand, make you no think say kuru, make I put hand under tap, kpekpekpe, I run out, I don wash hand with that. You never start. Una go put soap for your palm, make you use the other hand, rub am well, e go foam, you go dey see white soap. When you finish rubbing together, you go now use back the left hand, wash the back of right hand, wash the back of left, rub. When you finish, you go now bend your finger together like black man's power salute. Make una dey turn, twist am. Then the thumb, the one with the big finger, you go rub under the nail. You go rub all the dirty wey yama dey there, e go comot. You go now tell person, put your finger, rub it on the palm of your hand. The second hand, do the same thing. Put am under water, rinse am very well. Na hand washing be that o, make una no pass disease from one person.
The hand sanitizers are not going to be useful if you have dirty hands. They don't work on dirty hands because the germ load is probably quite high.
Germ load, as
Yes.
in the
Dirty way
dey
dey
there.
for hand.
Too plenty.
Too
Okay.
plenty. So you do need to wash your hands, and then
Often.
maybe often, and like she was referring to earlier on, maybe you touched a possibly contaminated surface,
Like in a
in
public
the
place.
public place, maybe a railing or something like that. Then you can use your hand sanitizer at that. It's better.
Very good.